Greetings, friends and followers. This is Nurses Talking. I am Dale Barsey. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here at Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today it is my great pleasure to welcome Chrstine Tindall. Chrstine is a school nurse, nationally certified school nurse. In 2023, she was nominated for School Nurse of the Year. In 2019, she was nominated for March of Dimes Virginia Charge Nurse of the Year. And in 2020, she was a runner-up recipient. Is that correct?
Yes, that's correct.
Of the March of Dimes Virginia Charge Nurse of the Year. And Chrstine says that she strives to provide person-centered care. Thank you so much for doing this, Chrstine.
Thank you for having me.
My absolute pleasure. My absolute pleasure. Firstly, what brought you to nursing?
So many things, like all of us. I think I was brought up in a home where my mom is an educator. She has been for over 40 years now. She's still doing it. She's ready to retire, but age-wise, but not
Yeah,
mentally or physically ready yet.
yeah.
My dad prior to me being born had been a police officer, so there's definitely a sense in my home growing up that public services is
Mhm.
something that's important
Yeah.
when you're choosing a career. And I had some lovely experiences. My grandmother was involved in hospice care when she was at the end of her life, and just seeing the way that different people worked within that system was a little bit eye-opening, and it was at
Mhm.
a pretty pivotal time. So
Mhm.
that was definitely an impact.
So, having decided, so did you struggle with that decision though? Was there anything else that you wanted to do? To think if you weren't a
Yes.
nurse, you might have been this? What was it?
Yeah. I think teaching was always something that was there. I have two siblings, one of which is a teacher. Well, both are teachers now, actually.
Yeah.
I think I struggled trying to figure out exactly what area of public service I wanted to go into. Nursing really kind of it hit that sweet spot where there's science involved and there's a little bit of an art to it.
Yeah.
And just kind of encompassed everything I was looking for, and there's opportunities in nursing that you don't have in other careers where, you know, you know,
Mhm. Yes.
you
Yes.
can do pretty much anything with your RN and a good degree. So
Anything you
yeah,
want.
yeah. But I think teaching was primarily my interest other than nursing.
So once you became a nurse though, um, was it what you thought it would be?
Not at all. Not at all. I think I don't want to say glamorize because I don't think anyone thinks it's glamorous to be a nurse, but
Mhm.
I do think you start off at least at the beginning of nursing school thinking every day I'm going to make a difference. Every day is going to
Mhm.
be
Mhm.
some inspirational Grey's Anatomy episode.
Yeah.
And that's just not the case. I think you can find joy in each and every day. And you can find joy in each and every interactions you have with
Mhm.
patients. But sometimes it's harder to find that joy.
Yeah. Yeah.
And some days you're going to feel defeated, and some days you're not going to feel like you're making any differences.
Yeah.
And that can definitely become a struggle. And, I think that's something I wish that we would have maybe had a little bit more discussion around when I was in school, kind of as a preparation.
Mhm.
You know,
Mhm.
nurses are great, but there's times where you're not going to feel it.
I know. There are times when you just want to just pack it in and you're like, I
Yeah.
cannot do this anymore. And then guess what? The next day you get up and you do it.
Yes, absolutely, absolutely. Well, yeah, I know for me it was one of the big struggles was seeing the same patients come back again and again and again. And I had an understanding of what was causing them to return and the readmissions and all of that. And I didn't feel like the way that the health systems, at least in the US, are set up,
Yes.
it's not set up for success for them, unfortunately. Um, the readmissions that we would see, it was more than just health. And that's why I know you said person-centered, and thank you for getting that correct instead of patient-centered.
Mhm.
I think that, when I was in high school going into college, it was more patient-centered. That was the
Yeah,
buzzword, was
yeah,
patient-centered.
yeah.
Which still kind of missed the mark, it was focusing on that diagnosis still. Whereas, once I learned more about person-centered, I was like, that
That
clicks
is
for me. You got to treat the whole person, and not the disease. Someone with diabetes, it's the
Mhm.
diabetes is ancillary to the person, and you
Is
got
it-
to help them figure
Exactly,
out what role does that play in their life.
exactly,
Um, yeah.
exactly, exactly. It's taken us a long time to get to this place, actually, because we used to kind of refer to people by their diagnoses and by
Mhm.
their, anyway, anyway.
Yeah, the diabetic in
We're
room
mo-
6.
Exactly, exactly. Exactly. What made you choose school nursing now?
I got to a point with the frustration that we were just discussing about seeing the readmission, readmission, readmission.
Mm-hmm.
And I kind of I it wasn't impulsive at all, but I definitely it was a drastic change that I made all of a sudden from hospital nursing. I went from being a bedside adult
Yeah.
progressive care nurse. And I realized it wasn't working for me anymore and that I was not having that joy, and um I just didn't feel like I could be that nurse anymore.
Mm-hmm. Mm-hmm.
So at that point, of course still had to make money.
Yeah.
So I took a step back from working within one organization and I started doing travel nursing.
Okay.
All this time, I'd always wanted to do public health of some sort, community health, public health. I had had the I had had a chance to shadow a school nurse when I was in college, which was awesome. And I really got a chance to see what that role could look like.
Wow. Mhm.
Um, but I didn't think I'd be able to. I just
What?
thought I don't have the experience. I don't have
Mm,
that, pediatric ICU or, whatever it was that I thought
yeah.
that I needed. I thought I didn't have it. Um, and then while I was travel nursing, I met one of my really good friends, Callie, and she was travel nursing with me. And then our contract was finishing up, and I was looking at what's my next contract going to be. And she told me that she was like, "Oh, well, I'm not doing a contract. I'm going to go become a school nurse." And I was like, "Huh, I've always wanted to do that, but all the reasons why I
Yeah.
shouldn't, wouldn't." And she kind of had a little bit of an answer for all of those things. She was like, "You don't need, no, 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 you're fine. You're fine. Just apply. See what happens. Apply and just talk with them and see what the job is like." Um, so I did. And we ended up working in the same county together, and I don't want to say I fell into it because it definitely was something I chose. But what I really love about it, honestly, is I think if you start at the basis of what is causing a lot of issues that we see in adults,
Mhm.
um, it can be traced back to that foundation that they had in school. And not necessarily in school, because a lot of it happens outside of school too.
Yeah. Mhm.
But
But in those school
having
years.
having that reliable adult in the building, or
Mhm.
having somebody that will maybe catch something, um, something like PANS or PANDAS, that's something that might not be caught unless there's a medical person that is seeing them from day to day and noticing that. Um, and I think that was one of the things that definitely drew me to it. Was I was looking at the issues that I was seeing around me that I didn't like in the hospital. I thought if I could get in at that ground level, maybe, just maybe, it would make a difference. Um, and I've only been doing it for a couple years, so I don't know, but um, it feels like it's better. It feels better on the inside when
I
I
was
come
about
home
I
from
was
work.
about to ask you, how does that feel? Because you know what, I really think that you get the feedback. You don't have to wait years to see the result of what you're doing. You may not see the big result, but certainly you see the seed of that intervention. So yeah.
Yeah, we just had my school had a career day. So I used to work in the high schools.
Mhm.
And most recently I switched to elementary school, which I was like, oh goodness, little people. Uh, so much scarier. But it was a really wonderful change. And we had a career day, and the kids were encouraged to dress up as, what they want to be when they get older. And I had this one little girl dress up like a nurse. And it was, I walked out, they were showing them fire trucks and all sorts of really cool stuff. And I came out and I walked by her because I was bringing someone left their coat inside and I was bringing it out to them. And I passed this little girl and she was like, Nurse Tindall, look, I'm a nurse. And it
So,
was just so sweet. And seeing that, it's like, wow, like think of if she becomes a nurse one day. Like how cool is that I got to see her as like a little nurse.
so I have a question that may not have any relevance at all, but so did she dress up as a nurse in scrubs or a nurse in a white uniform?
Scrubs. And like a
Scrubs,
little white
yes.
coat. It was very cute. I think it was actually like a Doc McStuffins outfit.
Okay, yeah.
So
Yeah.
yeah, so I was like, I very professional looking. She could
Yeah.
have my job one day if she'd like it. I would trust her.
Excellent. Excellent. I love it. So I asked that actually because I think that I have nothing against that white uniform thing. I really don't. But I think that a lot of us saw that in our heads and that starched and professional looking thing. And a lot of that contributed, in my view anyway, to the disconnect between what we saw and what it was.
Yeah. Well, and
So,
my whole thing with that idea of like the staunch nurse with the hat properly in place and all of that is it traces back to a time of nursing that it's just not it's not realistic anymore. You're not going to have these young women that come in and you know th- it's just not realistic. Florence Nightingale nowadays, I love Florence Nightingale. I think she's wonderful. I- if she were a nurse right now, I don't know that I'd want her to be my manager. Like that would be a lot.
yeah, exactly. And I really always from day one, I kind of despised the hat. But anyway, I
I never had the joy of wearing one.
became a nurse in the mid 1970s. Um, and I did have the the joy of wearing the hat. And this was in England, and there was absolute competition between major hospitals. The hats, and the intricacies of the hats. I remember thinking in my first week in nursing school, thinking, "Oh my God, I've joined a nunnery." And
Now, did you get a different hat at different levels of nursing within the same organization?
yes, ma'am.
Oh, of course,
A
of
different
course.
hat, a different belt color. Ah,
Yes.
different room in the hostel.
Oh my
Oh my
word.
dear. Anyway, that's a long
Isn't
story.
it nice that hats are gone?
Thank
I
God.
don't think I could have hacked it.
So now, anyway, we've gone back from the hats, and here we are. So, in the mid 2020s, and technology is a big thing, and it's bang into healthcare and how we provide healthcare and stuff like that. And a lot of us are expressing some of us are really scared about it, some of us are looking to embrace it. What do you think? How do you think it's going to impact the way we practice nursing in the next few years?
I think we've already seen how it impacts. Even just a small change will impact, a change from, oh gosh, I'm trying to think of the different charting systems, but from one charting system to another,
Yeah.
there's a huge difference in the efficiency of nursing with different charting systems, things like
Yeah.
that. I think specifically within school nursing, I think it's going to be very interesting to see how um, having that data collection, having
Hmm.
that all the nurses in the schools are going to be, you know, writing up what their, the conditions, whatever the
Yeah.
scrapes knee from the playground, or, concussion or case management, immunizations, that kind of stuff. We're going
Yeah.
to be, we're going to be putting some sort of designation. And what's interesting is to pull those logs basically. And you
Uh-huh.
can see, statistically, I see 400 students a month, and I see, 300 of them are for scraped knees. And it's like, well, what can we do to fix that? And I think that data collection is not only going to allow school nurses to be more effective with things like purchasing supplies, or making maybe like policy changes within their districts, things like that. But I think also it's going to allow at a different level for school nurses to advocate for what is a school nurse at like a legislative level.
Yes.
I think
Yes.
people will be able to see the impact, because there's something different, I think it seems, for politicians when it is, this is what is best for the children, all of that.
Mm-hmm.
Of course, I'm sure they care on a humanity level.
Yeah.
Um, but when you can show them hard and fast numbers, and you can show them money,
Yeah.
and
Yeah.
how will this help us save money, or
Yeah.
that kind of thing, I think that's when you're going to see a change.
Yeah.
I think what we're looking at right now, specifically, I think in Virginia, if I remember correctly, and they were working on it. I don't know that they've actually passed any laws or anything yet, but there was a whole discussion surrounding what is a school nurse. Schools can give someone the title of school nurse, and they might not even be a nurse, like of any sort. CNA, LPN, RN, they just might be someone's mom that is, basically trained on how to do things. And, while that's wonderful that they want to help, should we be using that title?
Yeah.
That's the
I
question. Should
wasn't
they get that
aware of
title?
that.
Yeah, it was, I'm trying to remember exactly what it was. But yeah, I'll find it and I'll send it to you. But it is something that was
Yeah.
talked about recently. And I think it was at I went to the Virginia Association of School Nurses fall
Uh-huh.
conference, and then last summer I was also lucky enough to get to go to the National School Nurse Conference, and it was at one of those where they were talking about specifically that. It was really very interesting, and very, yeah. It was one of those, you can call yourself a nurse, that like, but what does that mean?
What does that mean?
Are
What does
you
that
are you
mean?
qualified? Are you, are you giving parents a sense of false
Exactly.
security?
I was about to
You
go
know,
there. Parents have a different expectation, a certain
Mhm.
expectation, and you can't meet that.
Absolutely. So it's
Wow.
just interesting. Yeah, I'll find it for you, and I'll fact check myself, because it
Thank
does
you.
sound a little fantastical, but
Yeah. Oh, wow. So, what advice, though, would you think you'd want to give someone who wants to be a nurse?
I would say, I used to tell high schoolers this all the time when they would come to me saying, I think I want to be a nurse. I'd be like, well, become a nurse if you can't not become a nurse. And in that, I mean, if if you're wanting to be a nurse because I want to make a difference in
Correct.
the world, I want to, I want to, I don't know. That's just the little things that people, the kind of like
Yeah,
the general vague statements people have and the ideas that
yeah,
they have. I think that's a great start. But if you go into nursing and you're only there before that, almost the external
yeah.
factors,
Mm,
um, you need to have more than that to
yeah,
sustain yourself as a nurse.
yeah,
I think if your heart's not in it, and you're looking at it and you're like, oh, job security, and decent pay right out of college, and flexible scheduling, and those things are wonderful. And I see it a lot with people talking about travel nursing. It's like, that's what it's wonderful, and they definitely fill a gap in staffing and all of that. But I think, like, if you're looking at it from that standpoint, um, you are going to you're going to burn out at some point, unless it changes and it evolves, what you enjoy. But yeah, I think if you don't have some sort of internal, like intrinsic factor that makes you want to be a nurse, it's
sooner rather than
not going to
later,
be
you're
good.
gone.
Yeah, and you might be a fantastic nurse, but I don't think you're going to be happy doing it.
No, 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 no. It takes
Yeah.
it out of you.
Yeah.
Even at the best of times, um, it takes it out of you. So
Yeah. So I don't know if
what do
that's
you,
good advice or not, but that's the advice I would give.
yeah, it actually is.
Is only
It
do it if
is.
you can't, if there's nothing else that you want and you know this is what
Mm-hmm.
you want, then do
Yeah, yeah. If nothing else fit the bill. Yeah, gotcha. What do you do for self-care?
it. That's a loaded question.
Mm,
It's definitely changed over the years. There's a big difference when I first started nursing. I was newly married and I was just starting out and I was in an apartment and all of that. And at this point now, almost 10 years in, I have two young children. I work in a completely different area of nursing, so it's definitely changed. I used to be able to do more um, like long-term things, I could pull out the paints and now it's more like I want to paint, I'm gonna paint with my kids. And
wow.
then is that
Mhm.
self-care? I'm not sure anymore. But I think slowly but surely I've been finding things that I can do, just take out a couple minutes here and there. It's shorter term self-care. Um, and that seems to be working. There's something I saw that was flamingos lose their pink when they're caring for
Mhm.
the young.
Yeah,
It was Who was that? I think there's a it's I think her first name's Lindsay, but anyway, she's some sort of social media
yeah.
person. And I remember watching that and I fact checked it, so I'm pretty sure it's right. But yeah, they lose their pink while they're caring for their young. And I think it's easy in nursing to even do that. You're caring for
Yeah,
your patients all day long. You're
yeah,
caring when you care about you. And if you don't take those little moments that you can,
yeah,
you're gonna that's how you
yeah.
get your pink.
And
So
that's
after
one of the
this, I'm
things
gonna
that
go get myself some coffee.
that's one of the things we learn as nurses, though, is to take the short, um, because we don't, or we often do not have time for a long self-indulgence, especially if we're nurses and parents and all of that. And so we have to grab the little short ones.
Yeah, definitely.
Yeah, yeah, yeah. Exactly, exactly. Um, what would you say if you had to tell me in one word what the most essential quality of a nurse is? What would that word be?
Integrity.
Integrity.
Yeah.
Okay, I'm
I
good
think
with that one.
if you make your decisions with integrity in mind, um, if you lead with integrity, you will rarely go wrong.
You were really correct. Absolutely, absolutely, absolutely. I agree with you. I agree with you. Before we go, Christine, is there any little gem you'd like to leave us with?
Oh goodness. Just that nursing is always going to be evolving and changing. And finding your niche within that is going to bring you a lot of joy. Um, I think I've just found mine within the last 2 years with school nursing.
Mhm.
I can't imagine doing anything else right now. So I think once you find that sweet spot within nursing, you're going to really be able to be successful,
Yeah,
within yourself and within your career. But you're also going to be the most effective. And
yeah,
that's
yeah.
been what I've been learning.
And that's true because there really is a niche for every single nurse. There
Absolutely.
is.
Yep.
Christine, thank you so very, very much for this conversation. I truly
Yeah.
appreciate it.
Thank you. It's been lovely.
My absolute pleasure.